Hello. We're live again. So this is our health expert series, guys. And today I've been really honored to get our special guest, Mindy Duncan, today. She's a clinical naturopath as well. So welcome, Mindy.
Hi.
How are you? So tell us a bit about, because I've always been curious as well about naturopathy. What is naturopathy, and how did you come across it? How did you get into naturopathy?
Well, thanks for having me, Bob.
Thank you for being here.
How I guess I'll start off with how I got into naturopathy, because it's kind of it's a bit of a silly story, really. I never really had, I guess, a burning passion for naturopathy. I didn't really know what it was before I started. I'd never grown up with either seeing a naturopath or having, some kind of health story where I went and saw a naturopath and they cured me, and then ended up with a passion for it, I guess. But I had always had a big interest in health and really wanted to get into nutrition. And that was where I kind of saw myself going in a more nutrition and dietetic kind of route. And I found Endeavour and started investigating doing the nutrition degree there. And I kind of stumbled across the naturopathy degree. And I don't know, I just spent quite a while talking to one of the lecturers there, what was the difference between them. And it just made so much more sense at the time. You did that extra year of qualification and you had all these extra tools in your kit. And I kind of went from there. But yeah, I remember going home that day madly, Googling, what is a naturopath? What does a naturopath actually do? And and never really looked back. But yeah, I had no preconceived idea about what a naturopath was, or what the industry was like, or what we would be doing. But it was definitely one of the best decisions I ever made. So.
Oh, okay. So you mentioned earlier what is naturopathy? So that's kind of something that I've never come across until, because I was always focused on Chinese medicine, and I didn't had, because you guys know so much. I'm kind of ashamed sometimes because you guys know so much more about Chinese medicine than I know about naturopathy. So what is naturopathy?
It's interesting that you say that about Chinese medicine, because there's so many herbs that we use that we probably don't even realize are also traditional Chinese herbs, but they obviously have very different names and maybe slightly different uses in traditional Chinese medicine, like astragalus. We were talking about that the other day. Or any of the mushrooms, the medicinal mushrooms have, naturopathic or, more allopathic kind of use, I guess. And then there's a traditional Chinese medicine use. So there's a lot of crossover between them that you wouldn't even realize. But I guess, so what is naturopathy? Kind of summarize it, I guess. It is essentially a holistic practice where we look at how all of the systems of the body interact with one another to try and find the root cause of the health concern that obviously the patient is experiencing. And we have a whole host of tools that we use. So typically that's anything from nutritionals to herbal medicines to lifestyle modifications. And we really kind of oversee all of that and try and implement what we think, using obviously evidence-based practice, to try and essentially resolve what that patient is experiencing. But it really is more of a deep dive into that person's lifestyle, their past health, what they've been experiencing, any other health concerns that they have, underlying nutritional deficiencies, things like stress, maybe lifestyle factors that may be contributing to that condition, and trying to kind of resolve all of those factors to essentially get someone back into homeostasis, which is that balance that we're all kind of looking for. So that, I guess, in a nutshell, is what naturopathy is all about. It's, about helping someone understand their body better and try and get to that kind of root cause of the problem, and use all of those amazing tools that we have to essentially assist that body back into recovery, or essentially help the body heal itself, I guess, which kind of sounds kind of funny, but that's essentially how it works.
That actually makes sense. It sounds like a very close cousin to what Chinese medicine does. It's all about holistic, looking at lifestyle, not just, okay, where's the pain or where's the problem? Here's a pill. I think the advantage you guys have, it's a lot of it is very heavily researched. It's very, very backed up by concrete data as well. And that,
definitely. Yeah, and I mean, like you said, like nothing happens in isolation, and we'd be doing ourselves a huge disservice and our patients a huge disservice if we consider that anything does occur in isolation. And yeah, like you said, there is so much amazing evidence that's mounting in terms of, the things that we use, our nutritionals and herbal medicine, lifestyle, all that kind of thing in terms of how they work. So it's such a amazing area and field to be in at the moment, because there is so much amazing evidence that backs up what we do and how we use what we use. So it's pretty incredible.
And you do you work with quite a lot of hormonal issues in women's health as well. So a lot of your website is focused on that. So how would you say naturopathy helps with something like, I don't know, endometriosis or period pain? Like how does it help?
How does it help with endometriosis or period pain? I guess it really depends on it is definitely something that's well researched in those areas.
Exactly.
But it really depends on the person. Like it really comes down to that individual's kind of set of symptoms, their health history. There's not really one size fits all. In terms of, say, endometriosis or period pain. I mean, period pain in a nutshell can be assisted with a few kind of very basic treatments, but obviously if that period pain doesn't resolve with those basic treatments, then you start to obviously encourage that patient to go and get a diagnosis or further investigations for something like endometriosis, which can be very much a long-term management plan, I guess. But yeah, it's not really necessarily like a one treatment in terms of how you would resolve those things.
How would like say someone had, I don't know, just for instance, period pain or endometriosis, would you look at diet first, or would you look at some bloods, or what would you say, like, what do you look for first when someone comes in, like, say, I don't know, I'm a female and I come in and say, hey Mindy, I have period pain. Like,
I can kind of see it. So with period pain, I guess one of the best places to start off with is obviously diet. Diet and lifestyle have probably the biggest effect on period pain. Things like dairy. Dairy has quite a significant impact on period pain because of its the way that it kind of affects the like inflammatory pathways in the body. So typically with someone who's experiencing period pain, that would be kind of first point of call, I guess, is to maybe try and do a trial, like a month trial of dairy-free. Things like sugar and alcohol. Alcohol actually does affect period pain quite significantly, as well as premenstrual syndrome as well. Any kind of premenstrual symptoms like anxiety, especially premenstrual anxiety, is really highly linked with alcohol consumption. And then there's other kind of nutritionals that you would look at. So magnesium deficiency is another kind of common thing with period pain. So whether someone's under, quite a lot of stress in their life, and they're chewing through those magnesium stores and they have a much higher demand for magnesium, then that is also something that you can look at. And then there's also your other like anti-inflammatories, like your curcumin and fish oil have some really great evidence behind them for pain and inflammation. So looking at those kind of things as well. But also, looking at the general person's diet. Are they eating more of a kind of animal-based diet? Are they eating a lot more kind of, red meat than dairy, any other animal products, that kind of thing? Are they consuming a lot of that and they're not getting enough of your kind of plant-based foods, fiber, that kind of thing? But also looking at their lifestyle, like how do they manage stress, and how are they exercising, all those kinds of things. So are they sleeping? Because that's obviously a huge factor and linked with stress. But there's quite a few things, but absolutely diet would be the first place that you would look into, especially for something as simple as, if it's just period pain, it typically would resolve with a few small changes.
I think that's kind of so what I'm understanding is like it's a deep dive into the person's lifestyle
Yeah.
in terms of diet, sleep,
Absolutely.
exercise as well. So something you wouldn't fit into a GP appointment because they're like talking to the computer and like, all right, here's some pills. Like it's really like, okay,
Yeah.
what are you eating? What are you doing
Yeah.
on? Oh, that
Yeah.
actually is a very holistic approach, actually. And I was actually flipping through your website. You have some interesting facts on there as well. Like I ran across one like cortisol robs your body of
Progesterone.
progesterone to make more cortisol. Like that's insane.
Yeah.
So it's like this
It's
vicious
crazy.
cycle.
And that's really one of the factors that we look at, because it's
Mm,
essentially made from the same base molecule in the body. So
mm,
cortisol and progesterone are made from the same kind of base
yeah,
molecule, which is cholesterol. So if
yeah,
you're needing to make more cortisol, and cortisol is obviously a survival hormone, the
yeah,
body wants you to obviously survive. So it's going to consistently make more cortisol to assist with that kind of process
yeah,
at the kind of loss of progesterone. And obviously the body is very clever, and it knows that, when we're in a kind of stressful situation, that we don't want to be having a baby. Like, we don't want to be
right,
bringing a baby into a stressful situation. So
right,
it essentially will kind of shut down that system, or kind of turn off those hormones to some degree.
yeah,
And then you aren't making as much progesterone, and then you end up with or can end up with a whole host of other symptoms
that
because of that loss.
that makes
Um,
sense.
yeah,
Yeah,
so stress is the kind of, I guess, one of the biggest core things that I think all health practitioners look at is
yeah,
stress management. Chronic stress seems to be the kind of modern day disease, really.
mm, mm,
We all experience it to some degree, but it's also about how you're managing that stress. Do you have a good self-care routine in place?
yeah,
A lot of people have a really stressful job, and that's something that's unavoidable, or they have a really stressful home life, or there's a lot of pressure on them from many different places in their life. But there's lots of things that you can implement to help that person manage that stress better.
yeah,
Exercise, taking that 5 minutes a day just to even meditate, or have a bath, or just a little routine that you have that's yours, just to
mm,
tell your body that it's okay, essentially.
yeah, yeah. That makes a lot of sense. I mean, I guess for those of you that don't know what cortisol and progesterone, they're basically hormones, right? Like, so
Yeah.
cortisol is that stress hormone your body makes when you're stressed and threatened, and then progesterone is just
Mm,
a female hormone as well. So
mm,
yeah, but I had no idea the connection. I didn't know that was a vicious cycle. And and also like it was like what,
yeah.
a quarter of everyone is anemic as well, or all majority, not a majority, but a portion of the population is anemic as well. No.
Yeah, so iron deficiency anemia is a
Mm,
huge nutritional deficiency that I'm sure that you would see all the time in clinic as
yeah,
well, Bob.
yeah,
But yeah, so many people experience. Yeah, so the statistic is at this point, 25% of the population, which is mainly women, pregnant, non-pregnant, and children,
yeah.
experience iron deficiency anemia. Yeah, that's correct.
And that has a lot to do with period as well, and menses, because if you're losing a lot of blood, you don't have a lot of blood to begin with. So
Yeah, yeah. Yeah, exactly. Yeah, and that's definitely one of the common reasons that we would see, obviously, women experiencing more iron deficiency anemia is that
mm,
loss of blood every month. You're losing iron through that menstrual cycle, so menstrual
yeah,
blood. And then it's, a more difficult nutrient to kind of regain for a lot of women,
yeah,
because obviously we're seeing this kind of popularity in vegan diets, vegetarian
yeah,
diets, and that more plant-based living, which
yeah,
is amazing.
yeah,
But there's that kind of loss of iron intake that a lot of women are experiencing as well, because
mm,
potentially they're not understanding how to replace that iron correctly through diet,
yeah,
or through supplementation, or whatever. So
yeah. And that's where
yeah,
you
it's
come
really
in,
fun.
because that's where you come in. Like
Yeah.
you look at the bloods and you make recommendations on, okay, this is
Yeah.
good. That documentary is good, but probably you should be doing this as well. And
Yeah, definitely. Documentaries, they have a lot more power over the people than we think.
yeah, yeah,
Yeah.
yeah. And so I think one thing you guys are really great at is what you're good at is you're looking at you look at bloods, and you look at different
Yeah.
hormone levels, and I think that gives a lot more faith in the practitioner when you're looking at it, like, okay, cool, this is what we can
Mm.
do. And that's what
It's so important.
yeah, what do you look for when you're seeing a woman's health related patient in their bloods?
Well, typically you're looking for obviously anything that's outside of the normal range, obviously similar to any other practitioner, or doctor, or nutritionist, anyone else who's looking at pathologies. But you're also looking for things that are suboptimal. You're looking for hormones or nutritionals or any other markers that may be kind of close to that end of range, or like close to the kind of bottom end of the range, so that you can essentially prevent that person from either ending up with a deficiency or having an inflammatory kind of condition emerge, or the activation of, say, like an autoimmune condition or those sort of things. So you can really start to look at all of these kind of pathologies and kind of map out where that person is at that stage, and maybe try and prevent, because obviously prevention is better than cure, prevent that person from obviously ending up in a much more difficult health situation than they may be already in. So you're obviously looking for little clues along the way, rather than, oh, that's a deficiency, we're going to treat that now. You're really looking for something that could potentially turn into a deficiency, and obviously trying to work that patient away from that, and try and prevent it. So you're really trying to piece everything together and try and kind of predict what could happen, and prevent someone from ending up in a situation where they may be feeling a lot worse than they already do.
I think a very common thing is like when someone gets a blood, they're like, oh, well, you're low in iron, so okay, just run to the pharmacy and get some iron supplements. Like, and it's what you're saying is not that simple, is it?
No, not for everyone. And some people it is, absolutely. It's, maybe just a factor they're not having enough in their diet, or maybe they, changed their diet, they didn't have enough iron to begin with or something. But there's typically lots of different factors that can cause someone to be low in iron that don't necessarily all kind of, that don't necessarily apply to having a low consumption of iron. So, that's why it's so important to do like a full health history check and make sure that everyone is, making sure they're obviously consuming enough iron, but there's nothing else that's going on that is potentially hindering them from absorbing the iron that they are intaking, or that they're not able to even restore their iron correctly. So there's so much that you really need to take into consideration, for sure.
Right. So you may not be absorbing the iron. You could be taking a supplement, but something could be causing it to be not processing correctly in the body. Interesting.
Definitely. Yeah, definitely. Things like inflammation, if you've got maybe you've got a infection, so you've got like a gut bug, like a parasite, that will impair your absorption. If you have lack of vitamin A is a really common one as well. Things like that. Definitely loss of blood. So if you're having really heavy periods from endometriosis or fibroids, or just generally, heavy menstrual cycles, that sort of thing. There's lots of reasons that someone might be low.
Right. And actually, I was just thinking about off the top of my head, I'm going to switch gears a bit. So, and you work with the immune system as well?
Typically, I mean, as a naturopath, yes, you do have to consider the immune system, because obviously it's so involved in every aspect of our health, not just from an inflammatory perspective, but obviously from a kind of infection perspective, and autoimmune perspective. But definitely something that we consider as obviously a holistic health practitioner.
Yeah, I just thought I'd ask because it's pandemic season. Everyone's like talking about virus, and I've seen people just like buying heaps of immune function things as well. So it's good to get a different perspective as well, because what you said earlier about anemia can be gut related.
Like even just talking about that. There's so many factors. Obviously, like everybody wants to start taking all of these amazing herbs and things that will assist their immune function if they were to be exposed to any pathogen or whatever, will help their first line immune defense. But it's really important to make sure that your body is in a really good kind of state of health. So that means making sure things like your vitamin D status is really healthy, your iron status is really healthy, your vitamin A status is really healthy, your zinc status, those sort of things all of those things together will really help your body and help your system with any kind of infection. So they're the kind of little, I guess, tidbits that maybe get forgotten when everyone's really kind of amping up with all of these immune supportive products, and all those herbs are amazing, absolutely. And I would definitely get behind them, but it's really important to make sure that your actual health and all of your nutritionals and all of those factors, you're not, you know, really stressed, you've got that good self-care routine in place. All those kinds of things are really going to help you in terms of your immune health, especially around now this pandemic. But yeah, it's important not to forget about the little factors that really help your immune system throughout the entire year, rather than just in that one little time.
Right. Again, it's not like, all right, I'm going to take this supplement, but I'm going to go out to Macca's and grab some Coke and not exercise.
Yeah. No, it's definitely not that simple. So it's really important that you've got a kind of, you know, all year round health practice in place. And that means, you know, trying to eat as well as you can, you know, obviously as much as your means will allow you to, that you're managing your stress really well. And if you can't manage your stress, that you're, you know, I really encourage people to go and either seek help with that, either through either a naturopath, or whether that's a counselor, psychologist, whoever their support person is, to help them manage stress better. Or acupuncture is obviously amazing for stress management. They're obviously, the nutritionals are all up to scratch. You know, obviously if you're, you know, changing your diet, you're going more plant-based, that before you do that, you make sure you know where your iron is, your zinc is, your vitamin A is, all those kind of nutrition based things. You know where your kind of starting point is, and you kind of maintain those throughout the year. So you really have to have that kind of, like a holistic approach to your life to make sure that your immune health is good throughout every season, rather than just throughout winter.
100% agree.
Yeah.
So right now you're still open for consults as well. Are you doing mostly in clinic, or have you shifted to telehealth as well? Are you doing both at the moment?
I've mainly been doing telehealth at the moment, but I am shifting back to in-person this week.
Awesome. Okay. I didn't know that.
So I'm doing both, which is really cool, because it obviously gives people the option, depending on what they're obviously more comfortable with. I think that's the most important. But I am definitely switching back to doing that in person, face-to-face consulting from this week. And
if we were to find you, what is the best way if someone wanted to book in a telehealth conference or consult, or find out more about you and what you do? What's the best place to find you?
So the best place there's a few little avenues that you can kind of go down. So obviously to book in a consultation, you can call Vive, which is where I'm based, and the number is 33991002, or you can also go to the Vive website, the vivehealth.com.au website. You can also email me directly. My email contact is on my website, which is nourishnaturopathy.com.au. Or you can obviously find me under the same name on all my kind of social channels or what have you. But it's fairly easy to book in. If you have any questions, or if you're not sure whether naturopathy is right for you, or you're a bit kind of hesitant about it, always feel free to, drop me an email or give me a call, or try and get in contact and we can kind of talk about it. But the best obviously avenue is to try and go through the clinic, which is the Vive Health Clinic, which we both work at.
Cool. Awesome. Great. Well, thanks for taking the time to talk, Mindy. It was really really insightful, actually. It was really
awesome. I'm
All
really
right,
glad.
Mindy.
Thank you for having me.
All right, we'll talk soon, Mindy.
Awesome. See ya.